State lawmakers want to control the cost of health care here in Massachusetts. 22 News State House reporter Tiffany Chan is live in Boston, where they're trying to find out why prices can vary so much from one hospital to the next.
The 23-member commission is studying how health care costs are set. They're also trying to determine whether the quality of hospital care should impact how much you pay. Healthcare is expensive both for you and state government. Massachusetts spends billions on healthcare every year, and now state lawmakers are exploring ways to rein in costs. West Springfield State Senator Jim Welch is leading the Provider Price Commission that's studying why healthcare costs vary among hospitals.
When you talk about pricing of healthcare and pricing of procedures, I think people are focused on what type of quality they are going to be provided when it comes to the consumers.
The 23-member commission is made up of state lawmakers, medical leaders, and insurance providers. Senator Welch led a discussion about why hospital prices differ and whether they're warranted. The panel talked about how quality of care can play a role in pricing, as well as the location of the hospital and the population that's being served. Western Massachusetts, for example, has a larger share of Medicaid and Medicare patients, which can impact cost.
I've seen folks who are through the roof on quality, but yet again, their payer mix and geographical area of the patients that live are still not able to go there because of the type of insurance they have.
The Provider Price Commission has until March to come up with final recommendations and to create legislation. State lawmakers are considering whether to pass a law to control or regulate the cost of health care here in Massachusetts. Live at the State House in Boston, Tiffany Chan for 22 News.